Have you ever wondered what it's like to go through a clinical trial? My name is Jonathan James with Hope Charities, and I am so excited to talk to you a little bit about an upcoming event that we have going on at Hope called Emerging Therapies Conference. It's going to be a great event for patient education so that we can learn more about medications and also products that are currently in motion that could become the next future products that we could use to help lessen the burden of infusions and all types of really interesting technology that's going to be released over the next few years. Some may come to market, some may not. But we'd like to talk a little bit about some of those products that are emerging over time because I think it's important to educate ourselves on what's coming out next so that we can understand what's going on. I kind of think of myself as a little bit of a closet science nerd, and I love to research these things and find out what's going on. But I'm also kind of an old dog that's hard to teach new tricks. So I'm a walking contradiction. And if you're anything like me, it's great to be able to learn about these things and to try to understand what's going on. But we're also talking a little bit more about what it's like to go through a clinical trial. So, in the event that maybe you are going to your clinical visit and your doctor approaches you with an opportunity to participate in one of these trials, you maybe have a little bit of heads up of what that experience is like. And today I've invited a friend of mine, Amber Perkins, to join me to talk a little bit about her experience through a clinical trial. Amber, it's great to see you today. Thanks so much for joining me for the Hope Podcast.
Thank you for having me.
Well, I'm excited to learn a lot about your experience with going through a clinical trial. But, for people that are just now getting to meet you, I think it'd be great just to talk a little bit about your journey with living with bleeding disorder, how it affects your family, and where you're from.
Well, I am from Texas, and myself, I have von Willebrands, and my son also has von Willebrands. Um, my type is a little bit indeterminate, but we mostly say 2M, and my son is a type 1 severe.
Mm.
Um, and with that journey, it definitely has been a few years in the making.
Wow. Well, you have a background also in as a clinician yourself, as a nurse, right?
Yes, I have.
Yeah, so
Oh,
you
yes, I
have a
am.
lot of you have a lot of depth in terms of just understanding. You probably have more science nerd stuff going on in your brain than I will ever have, but you have this background of information and of course living with challenges yourself, going through the difficulties that you face personally, and then also now having your son going through the challenges that he's faced. You guys are very affected, and one of the things I think that's really interesting about your journey is that it wasn't always black and white. It wasn't very easy to detect at first, right?
No.
So tell
No,
me
it
a little
was
bit about
not.
how did you get diagnosed yourself?
So after years and, it really starts as being a young kid, never diagnosed and went through the years as the teenager, the adolescence phase, and then, you became, the an adult phase, years and years of signs and symptoms, the massive nosebleeds, as I like to call them, the ones that you think you're going to die kind of nosebleeds.
Yeah.
And then the female issues that come along with the bleeding disorder. Um, I ended up having different female surgeries and then ultimately ended up having a hysterectomy. And
Wow.
a year after my hysterectomy, only because I ended up having severe bruising all over my body. And I say severe because my body literally looked like I had been beat black and blue. And,
Wow.
the people that look at you, they're like, who was it? Where are they? And it's like, I promise
Mhm.
that's not what it is.
Mhm.
Um, so after months and months and months of testing, I was just fortunate enough to have a physician who was able and just basically made it a personal uh,
Mission.
mission, right? Personal mission to find a diagnosis and
That's
hope that we
amazing.
could treat it. So I want to say 10 months later, or almost a full year, was when it took to get a diagnosis.
Wow. Wow. And in that process of discovery, you realized that you'd had this hysterectomy and did you ever think
Right.
maybe if you had had some treatment available to you at that time, you might could have avoided that?
Absolutely. Absolutely. And,
Um,
I try not to let that get me down too much,
of
but
course.
it does make me wonder. I'm like, the doctors did not do their due diligence, you
Mm,
know, throughout my life to figure out what was going on. And of course, because women don't have bleeding disorders, it doesn't affect women. And as we
right.
all know now, every disease affects women, whether some people want to hop on the train or not. It's just
Yeah.
a reality, and so, you know, I don't wanna say point fingers and blame people or anything like that. It just now, I'm definitely an advocate for, if this is not normal. It's not normal to
Mhm.
do that, so it's simple. Just do a simple blood test.
Mhm.
Do a
Mhm.
simple blood test, and you can find out if you have a bleeding disorder.
I think that that's one of the things that's so important about having conversations like this is that it really helps to elevate the idea that these are things that really can be detected with simple blood work. It's just something that there's just lack of knowledge out there, even among a lot of
Right.
clinicians and doctors and OBGYNs, that really just don't realize. And
Mhm.
so I really think the
Mhm.
patient perspective, the patient voice really matters when it comes to these types of things. That's why I'm so motivated to keep working to try to elevate these issues, because if more and more people heard about it, there's a good chance that more and more people would start to look for it when these symptoms present themselves and really eliminate unnecessary suffering, right?
Absolutely, 100% agree.
Yeah. And so much later on, you end up getting on treatment yourself, and then your
Mhm.
son also starts to get treatment and recommended for prophylaxis treatment. I think, that's been a difficult journey for him as well, right?
Oh, absolutely. He was diagnosed when just before he turned 2 years old, only because, um, I guess we could say a little backstory is he is adopted. He is adopted from within the family. And so when I was gonna just go get ear tubes for him because he had all these, recurrent ear infections, they said, "Well, does anyone in the family have a bleeding disorder?" And I said, "Me." And they said, "But he's adopted." And I said, "Well, he is adopted, but he's adopted from within my own family." So they said, "Well, let's just go ahead and test him." And, it's just a simple blood test. Just like we said before, it's a simple blood test. And it just so happens to be, it took about 2 weeks to get the labs back. And just so happened to be that during that time, he ended up actually having bleeding symptoms himself. And the hematologist who was testing him and treating him said, I just happened to see these labs, and he definitely has von Willebrand's disease. And she said, "What's this all about?" She's seen the labs that we had since being in her office and having the testing done, and she said, "Oh, then he's actively bleeding. He needs to come straight to the office. No pass go. I was at work when she called me, and she
Wow.
said, "You need to tell your boss you need to leave immediately and go pick him up, and he needs to have an infusion right now." And of course, I'm
Wow.
scared to death, terrified because I don't know what's going on.
Right.
And so I just like driving like a maniac to pick him up and get back to the HTC to have him infused. And that's truly where I'm gonna say our major journey with him started. And
Mm.
so, and as a parent, you focus more on the child than you are on yourself. And
Mhm.
so, honestly, because of his journey, I've learned more about von Willebrand's and other bleeding disorders, because, even in nursing, you don't know about the other bleeding disorders. You only really learn about hemophilia.
Right.
And so, it's been a learning journey, and I learn something every time I go to a function, educational seminars. There's so
Yeah.
much to learn.
Yeah. It's so true.
So,
It's really endless in so many ways.
oh, it
It's
is.
yeah, and I think that that's one of the things that I've learned with living with a bleeding disorder myself is that sometimes I think clinicians, get a bad rap because they're, um, not doing as much as they could, or they're not investigating. And I truly believe they need to be held, to a high level of accountability for that.
Right.
And simultaneously, I mean, it's what, a paragraph in nursing school, and it's maybe a,
Right.
a, a page in, in so, even for hematology. Sometimes I was
Right.
just speaking with a friend of mine who's a hematologist, telling me that the coagulation lab portion of a hematology, I mean, this is the specialists, the people that should know, is the
Right.
coagulation lab itself is only like a 4 week, opportunity for them, and that's only if they choose it. And
Right.
a lot of them don't, because they're moving towards more the oncology side. And so anyway, there's a lot of things in play there that I think we don't fully understand. But I know that your journey has been challenged and it's been difficult, and there's been a lot of ups and downs. But how are things going now for your son and for you? Or you feel like you're making progress and things are getting better, or is it kind of the same, or still more to do?
I'm gonna say for myself, I don't have too many complaints. I mean, I still get the generalized bruising just like anybody else with with von
Hmm.
Willebrand's. I occasionally get nosebleeds, nothing that I'm too worried about too often. You just have to watch yourself in the wintertime and, it
Yeah.
gets dry, whatnot.
Yeah.
My son, on the other hand, he's had nose cauteries, all the things that they do for kiddos and, all the drugs that you would use to help prevent and all the things, And his journey, he is supposed to be on Profi 3 times a week. And of course, being a 7-year old, he really doesn't want to participate in that situation. So his his provider and I have just, said, he's just not old enough to not be traumatized. He's traumatized every single time he has to get stuck with a needle. So so we just do it on demand
Right.
for those severe nosebleeds. And,
Right.
if he has a mild bleed, then he gets the Amicar for a day. And,
Hmm. Hmm.
so we're just trying to
So
just
more
meet
work.
his basic needs.
Yeah, so more work needs to be done, right? And
Oh,
and
absolutely.
this is where looking down the pike to see, because there are numerous clinical trials going on right now for people living with various types of bleeding disorders. But I
Mhm.
believe that there's 26
Wow.
medications that are in the pipeline right now. We're going to be learning a lot more about
Wow.
this at this event coming up. But there is so much going on in the space, and numerous trials are going on actually for von Willebrand's disease, and efforts to support that particular segment of the population. So
Oh,
interesting to see what's
wow.
going on there. But I know that you had an opportunity to participate in a clinical trial that was not directly focused on your bleeding disorder, but it was actually a result of the challenges you incurred from your bleeding disorder, right?
Absolutely. And I would do it all over again.
Wow. So tell me a little bit about that. You find out about this medication that could help you with sort of a byproduct, right? Of
Right.
one of the surgeries you had had. What was that?
Right. So I on Facebook, you just scrolling, and it says, "Do you want to do a study for hot flashes?" And I said, "Where do I sign up?" So I filled out the information, and I get a phone call basically the next day. I was actually very surprised when they called me, and they said, they ended up sending me an email to answer some questions. Then they did a phone interview, and one thing leads to another, and I'm in their office getting
Wow.
started.
Wow. And the reason you had hot flashes was really because you had surgically induced early stage onset menopause because
Right.
of the hysterectomy. Is that right?
Correct. Absolutely.
Wow. And you didn't have just regular old, like, we're not talking about, I'm having to mansplain this right now because I have had to learn this the hard way. I've had several women in my life that had this exact same kind of surgical procedure done, but there is state. I mean, some people have really severe hot flashes that are just tormenting, and it sounds,
Right.
if I remember correctly, yours was extreme, right?
Yes. So they do have different levels. They go from mild up to severe.
Mhm.
and as the actual terms is severe or mild to severe, neurogenic hot flashes.
Wow.
And so, or neurovasal, I believe is what they call it,
Okay.
neurovasal. So it affects the vagus nerve, and
Right.
so full on, you get a hot flash, you get the beet red, you're literally sweating bullets, and
Wow.
so my house
And
stays cold year round.
and that's saying something from Texas. That means you gotta have good AC.
Good
What
AC,
about
that's right.
and so this was happening multiple times a day, every day, right?
Oh, all the time, throughout the
Yeah.
day. I've learned how to help curb those a little bit, but you know,
Yeah.
there's things you
So
can
you
do.
Yeah, and so you were looking for relief, like, anything that
Oh,
sounds like
absolutely.
relief, you're like, "Sign me up. I need this," right?
Take help. Yes, I will sign me up
Yeah.
free of
Yeah.
charge.
That's awesome. And so you went through this trial, and I'd love to for people to know a little bit more about what your experience was in this. It's kind of uncommon for, especially in bleeding disorders, to hear. Usually, most people hear about a clinical trial happening on at their treatment center. And while we don't really recommend that everybody just fills out forms on social media randomly,
Right,
at the same time, it happened to work out really well for you. And this turned out, and you probably knew this because of your clinician background, but here is an opportunity that presented itself, and
right,
it was a full medical investigation with a whole medical team and a whole lot going on, right? So tell me a little bit about what that
right.
journey was.
So it literally, other than those, interviews that I did, I went into the office, which ended up being probably 3 to 4 hour appointment. It was a very long appointment, I will just
Wow.
say. But literally, the nurse and the research provider went step by step, word for word, read all the forms. It wasn't, here's the forms, you can look over them. Do you have any questions? No, it was they read them word for word and gave
Wow.
me opportunities to ask questions. And so you're talking, it's a lot of forms,
Yeah.
at least 20 to 25 forms that you have to go through. And of course, it was a double blind study.
Mm.
So I didn't know, the clinician did not know what I was on. Was I on the drug or was I not on the drug? Nobody knew
Right.
until the very end, and that's when they tell whether you were actually on the drug or not.
Yeah, and so for
And
people listening, double blind placebo study a lot of times is
right,
every person, there's one of two treatments that's being offered to you at the time. One that's basically a null effect. It has no medication in it. The other one that
hmm
does have medication in it, and they're essentially trying to make certain that whatever symptoms you're reporting or feedback or side effects is actually real or not real. But they don't tell you, as
hmm
the person being studied, whether or not you got the real one or the fake one. And right, is
absolutely,
is that how that works? Yeah.
absolutely, and the provider didn't know either.
Right. Right.
So yeah,
So
so
you started taking this in this trial, and did you feel any difference?
I definitely could tell a major difference. I felt like
Wow.
a normal person. I thought,
Wow.
wow, this is what life is without, I still had a few hot flashes here and there, but very, very few. And for
Wow.
anyone who does not have them, I don't even know how to explain it except for it's miserable.
Mm.
I used to, people make fun of people who have hot flashes, like I remember making fun of my mother. And now I'm like, I think when you do something as a kid, you get it twofold as an adult. Well, I'm just saying, I think I got that twofold.
So be careful what you say, kids.
Exactly. Be careful what you say because it
That's
just
right.
might come back and bite you.
That's right. But so you start to feel immediate change and things start to get better. And then you go through this study for some period of time. There's some,
Mhm.
interaction and reporting involved and things you have to do to interact with the study.
Mhm.
And then I assume the study eventually came to an end where
To an end, yeah.
yeah. And so were you able to stay on the medication after the study, or did you have to get off of it?
I had to get off of it, sadly.
Mm,
I learned that there was another drug that was similar to it, but it was not the same thing. And of course, being a new drug, providers don't want to prescribe it.
mm,
So I said, well, I guess I'll just wait for this drug to come out because it had been approved. It
mm,
just didn't have a name yet. And
mm.
so those providers, or that provider did tell me that once the drug had a name and it was actually out on the shelves, that she would let me know so that I can purchase said drug.
Wow. Wow. And so if you had the opportunity and it does come out on the market, is it something you'd go back to or want to get on?
Oh, absolutely, hands down.
Wow. Wow.
Hands down. I would do a free commercial for them.
That's amazing. And just, I mean, for people that are listening that may have an opportunity to participate in a trial, clinical trial like this of really any kind for bleeding disorders or
Mhm.
otherwise. Is it something and it was it an experience that you felt like was valuable to you that you would want to, participate in future trials if they were an opportunity presented for you?
I would, participate in other trials, whether it be for hot flashes or, or for bleeding
Or
disorders or
vulnerable brains. Yeah.
whatever. It's definitely not something for the weak. Um, and what I mean by that is it does require a lot of work on your own, on your side, not just the provider, as far as
Mhm.
going into the office often and lab work often and
Mhm.
reporting. And so it's not necessarily what I would say for the week, but it's well worth it because I feel like what I did, I was the only person in my area who actually completed the study.
Oh, wow. Wow. That's
Everybody else
amazing.
said, I don't want, they got tired of going into the doctor's office. They get
Yeah.
tired of being stuck with needles or
Mhm.
tired of, whatever reasons. It just took too much time out of their life. And so
Yeah.
it's not for the weak, but it is absolutely well worth it in the end.
That's probably because living with a bleeding disorder, one thing I have noticed about everybody in this community is that we have stamina because we've had to go through so much. So you probably had the stick to
Right.
itiveness to keep going through it because you knew what it was like to finish strong. But it's really amazing to me to see that, we had this experience a lot in the, really in the 90s and early 2000s where people were able to participate in trials for some of the other comorbidities that the community experienced through the tainted blood products, such as hepatitis C and
Mhm.
others. And, lots of really amazing stories came out of that, of how these clinical trial programs were really beneficial to them, but it ultimately ended up being very beneficial to, the whole community of
Mhm.
people. Essentially, some of those medications that came out have been, what some people would refer to as almost a cure and
Right.
of those things. And so we certainly hope that with bleeding disorders that these things have to advance as well. And I do think it's interesting. It takes somebody to take a step and take the leap of faith and participate. But also, I think it's super important from an area of diversity, and trying to get that. And so I'm curious to your feedback and your thoughts on if an opportunity presented itself to you for von Willebrand studies, would that be something for you personally that you might be interested in participating in just because of your past experience with this other study?
Right. Absolutely. I mean, if the opportunity arises and, it's able to fit into, because it all comes down to your schedule and work
Yeah,
life balance. And
of course.
so, if it was something that absolutely that I could work into, absolutely.
Mhm.
I mean, if it's not for just myself, it's definitely for my community.
Yeah, I love that. Well, Amber, thank you so much for just having the courage to share your story and for being a part of this conversation today. I think a lot of people can relate to the fact that there's other things going on besides
Mhm.
just your bleeding disorder, sometimes caused by it as a ramification of living with a bleeding disorder,
Right.
sometimes not. But really, your courage to participate in the study, also to share your story of your journey, is one that's really admirable. And I really hope that we can continue to move the needle, lots of pun intended intended there, for
Right.
progress in our community one way or another. Because I think it really benefits everyone when these things create change that really helps so many people in need. And so I don't want to sound like I'm a big commercial for participating in any one medication or any particular type of trial. I'm not trying to promote anything here, other than I just think your story is such a great highlight to say that it really takes all of us. It really is an army. It's
It
not
does.
something that one person can do. It's something that we really, you said it earlier, about for the community. It really is something that we need to
Mhm.
continue to stick together collectively. And I know that we have a bright future just because of you and others who've also volunteered themselves to participate in these things. So thanks for jumping on here with me today and having this conversation. And thanks for all you've done for our community. And I hope things continue to progress in the direction you want them to in the future for you and your son.
Thank you. Thank you. And it's our pleasure.
Awesome. Well, we'll talk to you again soon.
All right. Thank you.
Thank you so much to Amber for sharing her story today. And I just want to say it's people like you and I who live with bleeding disorders that really need to take a stand in moments where we can, where we have liberty to and we want to participate in any way that we can, whether it's by volunteering in moments like this to jump on a conversation and share our vulnerability with people about what we've been through, or whether it's just about maybe participating in the greater good by these moments that are offered to us. Maybe your clinical trial participation is needed. And so I want you to join me, though, to talk a little bit more in depth about what's coming up next and what's happening in our community for people living with bleeding disorders on February 18th and 19th for a live online education event that we're calling Emerging Therapies. We're going to be doing a ton of giveaways in all of the sessions. We're going to have a lot of fun, and it's going to be a blast to be together. So I'd love for you to join me for that. And it's going to be a great opportunity to be able to meet some people maybe that you haven't met before, from all over the country, who may be living with bleeding disorder or other rare diseases and who need support. They need community, just like Amber and me getting together today. So we hope you will join us. You can jump on to our website at Hope-Charities and register right now for this event, or you can click this little QR code up here in the top left-hand corner of the screen, and it'll take you straight to the registration page. But we hope to see you there. It's going to be a great time. And once again, a big thank you to Amber for joining me today to talk a little bit more about what's going on in our community.